Hello, my name is Kid Dashwood. Thanks so much for joining our poster presentation on the redesigning of low-cost community-scale iron-based arsenic removal technologies. This is in partnership between Samaritans First Canada, Samaritan First Cambodia, and the Center for Affordable Water and Sanitation Technology. Groundwater is contaminated with arsenic is a prominent health risk for many communities around the world. There are existing household filters such as the Canchan arsenic filter, which are widely used and successful in addressing this challenge. However, our team identified the gap at the community and institutional scale of being able to deal with this arsenic contamination. Our team wanted to determine a way to scale up this technology, as well as couple it with existing intermittent slow sand filters, which are already in the field, to offer a low cost and highly effective means of removing arsenic at a larger scale. Our team was particularly interested in understanding the different parameters that would influence the scale up. In our case, we looked at different nail masses, nail sizes, degrees of aeration of influent water, residence time that iron and arsenic would be contacting, as well as the flow rate that we'd be operating at. To understand these parameters and to determine an effective configuration, we developed 6 different designs and tested them over a 100-day period at a site in rural Cambodia. Each of the designs would incorporate different levels of the parameters of interest and be tested 3 times a week for a number of different parameters, including arsenic concentration, phosphate, iron, and dissolved oxygen concentrations. Looking at our results table on the top, we see 2 things. First of all, we have the WHO recommended arsenic limit, which was our guideline and what our designs needed to achieve consistently to determine a successful design in this regard. We also have here our influent water arsenic concentration in parts per billion. This site had 500 parts per billion, which for the region was quite high and was quite a challenging place to design the study. Overall, you'll see the different lines here representing different configurations of the study, some of which perform better than others. But you'll see one configuration in particular, the arsenic filter 2, AF2, the yellow line in squares, performing able to reach the safe limit quite consistently over time, doing it over this 100-day period. Taking the data and analyzing all our different configurations, we determined several key things. First of all, nail mass is one of the most important factors we could determine in removing the arsenic. In our case, we found that 30 kilograms at a 1.5 liter per minute flow rate was the optimal mass for removing arsenic. We were able to remove 97.3% of arsenic using this mass. We found that below this, we would have drops in removal efficiency, and above the 30 kilograms, we would have insignificant improvements for the arsenic removal. Additionally, looking at the other factors discussed, aeration and nail size, both were deemed insignificant impacts on the study, which allows us to simplify the design in the future, allowing us to use different sizes of nail media or whatever is available in the region, and also not concerning ourselves too much with having to aerate the water before it runs through the filter. Additionally, we determined that acclimation periods of these design are very quick or non-existent, with a startup period here achieving high results very quickly and a restart period here doing similarly. We also theorize that there is a risk of a arsenic-3 species, which is very hard to remove and will, even with an optimal design, be very hard to remove and remain in the filtrate, which is a design consideration and a safety consideration that needs to be taken seriously moving forward, if that's to be the case. Finally, we determined that residence time is likely to be much shorter than 30 minutes as written in the literature and used with the Canchan arsenic filter. However, we had insufficient data to determine the exact optimal time, but this will be a focus of study in the future. Overall, we have results that show promise in the ability to scale up the Canchan arsenic filter and to maintain consistently high levels of removal of arsenic through the filter. We're taking next steps to redesign an arsenic filter 7, which will be optimized and coupled with an ISSF, and will be tested across different water chemistries in Cambodia to test its consistency and resiliency when dealing with different parameters and potentially lower parameters in the 500 parts per billion, where it could perform even better. We look forward to your questions and potential collaborations with you, and thanks so much for your time.
Thank you, Kit. I'm monitoring the chat tab on Pathable. So if you'd like to type your questions in there. And Kit, if you could, oh, you already have it up. Screen share your presentation. As we're waiting, if there's any additional kind of information you want to share about your research, feel free to bring that up. Oh, sorry, we have a question before you go for that. How do you envision the filter material containing the removed arsenic will be handled?
Excuse me. Thanks so much for the question. We've thought about this a lot. We've thought that just if we're removing arsenic from the water, but we're dumping it somewhere else, it could be just as much of a threat to the community as us intervening in the first place. So we've gone through a number of different ideas and designs to deal with this. Ultimately, we found that it's very difficult to get rid of it entirely, but the best thing we can do is to stabilize it and put it into into a format that will leach or the least risky format for getting back into the environment. So we've experimented with a few ways of solidifying it, stabilizing it, and sending it through another kind of groundwater filter, and able to put it underground and keep it safely there. And we found that this has been probably a successful model. We haven't piloted that in the field yet, but from early designs, it looks to be quite a good way of handling it.
Great, that was a great answer, thanks. I don't see any more questions, so if you'd like to, if there was
I can just add some exciting things. So no, thank you. Yeah, we've partnered with some additional organizations in Cambodia now who are going to take our filter, the AF7, which is the optimized design from our work. They're going to test this in multiple different sites. And what we're really curious to see is what happens when the phosphate levels are completely different than what we did, or how do we perform when the arsenic is only at 300 parts per billion, not 500. We're very excited to see how this design goes up against all those things. Similarly, kind of asking to the people here or the group here, anyone who's suffered or dealing with communities with the arsenic issue, what kind of parameters are you seeing there? And is there an interest to try the design there? We'd be curious to look at that as well. Ultimately, we have ideas of getting this to many sites in Cambodia and coupling it with the existing Samaritan's Purse filters there, but also ideas of getting it to Myanmar, which also has some of these issues, and potentially other regions as well. So anyone working in those areas or with similar problems, we'd love to connect with.
Great, thank you. And feel free to put any thoughts you have in the chat, because those will be saved.
That's great, thank you.
So it's always been an issue with removal, because you're transporting it from one site to another, and I'm interested to know how you communicate that
with the local community.
Yeah, I mean, it's about training, isn't it? How do you build that into the placement of these systems, especially in communities that are resource poor? And a lot of us are involved in this web training basis on site. Have you built that into communications? I'm sorry, am I supposed to be talking or writing?
We have about 30 seconds left, so if that's enough time, feel free to put it in the chat.
I'll try to take it on. No, wonderful question. We're still in the early days of that, to be honest, but we did have a multi-pronged approach. One was when we did our risk analysis of the sludge that was being produced, it was very, very low. And we were trying to find analogies or kind of stories that we could tell our community to community of the actual risk of the sludge being produced. So that was one avenue. The second one was to take kind of existing training on it of how to spread out your water from your sanitation, from your living spaces, from your eating spaces, kind of some of the existing information on that. I think it's spaced out into how many X meters and Y spacing and downriver kind of effects. So yes, we're definitely early days in trying to figure that out, but we know it's going to be a big consideration if we ask communities to store this on site. So
great, thank you. And it looks like there may be more questions in the chat, so feel free to head over there to answer.
Thanks so much.
Thank you.
Sarah, I think you're muted.
I knew that was going to happen at one point. Our next presenter is Estrella-You with the University of Virginia. So Manal, if you could share your screen and play the presentation.
Hi, everyone. Thank you. Hi, everyone. Thank you for being in this poster presentation where I'll be talking about the synergistic bacterial inactivation by silver ions and free chlorine in natural waters. As an introduction, there are many point-of-use technologies that use chemical disinfectants for water disinfection. Some of these technologies use silver and others use free chlorine. As examples, we have here this ceramic tablet and ceramic filter which use silver, and aqua tubs and bleach which use free chlorine. Each of these chemical disinfectants have advantages and disadvantages when used for water disinfection. There have been lab studies where these two chemicals have been combined in controlled conditions using synthetic waters. And these studies have demonstrated that there's a synergistic pathogen inactivation when used silver and free chlorine together. However, in the literature, there's a data gap where these two chemicals have not been tested in natural waters, where there could be a high chlorine demand or other variables that can affect the disinfection effectiveness of the chemicals. For this reason, the objectives of this study were to evaluate if there's a synergistic inactivation in natural waters when using low doses of silver ions and free chlorine. And also, we tested if turbidity and organic carbon influence the chemicals disinfection. To evaluate the synergistic effect, we used a previously published mathematical model, where if the result is lower than 1, there is a synergistic effect. We use natural waters from ponds and streams. These waters have different turbidity and also different organic carbon content. And to apply the chemical disinfectants, we use silver nitrate and aqua tubs. We made solutions of these different chemicals, and we added aliquots to a volume of 10 liters of natural waters. So here I'm showing the results of the disinfection of stream water. Here, after 3 hours of contact time, you can see the log removal for total coliform and E. coli. And this light gray bar shows the log removal when silver ions and free chlorine were combined. As you can see, this log removal is higher than the sum of the log removal of silver alone and chlorine alone, which suggests there's a synergistic effect. The same with E. coli inactivation. Also, in this graph, you can see that the log removal when silver ion was used alone is higher than when free chlorine was used alone. So this suggests that total coliforms were more sensitive to silver than free chlorine. Now, in this table, we can see how turbidity affected the effectiveness of the chemicals. For silver ions alone, you can see the log removal was not greatly affected when the turbidity was almost double. However, for free chlorine, you can see the log removal was greatly reduced. And finally, when evaluating the synergistic effect, you can see that all of the results are lower than 1, which suggests that there is a synergistic effect when using low doses of silver ions and free chlorine in natural waters. Thank you very much for your attention. I'll be happy to answer any questions. Please stop by room 2 on Tuesday the 5th at 2:45 p.m. Thank you.
All right, thank you, Anna. I'm now monitoring the chat tab for questions, so type in your questions there. And Anna, if you could share your presentation.
Thank you.
Okay, did you see silver chloride formation with the mixed oxidant?
Yes, thank you for the question. We didn't measure that, but there has been previous studies where it has shown that so I think the amounts of silver needed to form silver chloride to affect greatly the water, I think they have to be very high. I can look again and get back to that question to make sure, but there have been studies on that. But in this study, we didn't measure that.
Great, thank you. As we're waiting for more questions, is there anything else you'd like to share about your research?
Yes, so we have already point of use technologies that create free chlorine immediately. Like, for example, the aqua tap, you put it in water, you wait 30 minutes, and the free chlorine is already available for pathogens inactivation. However, the concentrations that are there are very high that they can greatly change the taste or odor of the water. So I'm working on developing a new technology that will release low doses of free chlorine. As you can see in this study, even very low doses, like 100 micrograms per liter, combined with silver in 10 micrograms per liter are effective for bacteria inactivation. For example, the aqua tap, I think it can form almost 2,000 micrograms per liter. So that's almost 10 times, 20 times higher of what I use in this study. So I'm working on that, trying to create something that doesn't release very high amounts of free chlorine, but are still effective in killing bacteria.
Great, thanks for sharing that. It looks like there aren't any questions in the chat right now, but if anyone can think of any that they would like to ask later, feel free to put them in the chat and you can kind of go and monitor that. All right, well, we'll move on to our next presenter then. All right, our next presenter is Joshua Miller with UNC Chapel Hill.
Hi, everyone. Thank you for joining this session. I'm excited to share with you findings from the first global assessment of perceived drinking water risks. These data are exciting because most national level surveys only ask about the water sources that a household has access to, and not whether they trust or prefer these sources. This is important because attitudes and beliefs about one's water source influence whether they use it or not. So for instance, if somebody thinks that their tap water is unsafe, they are more likely to use bottled water and to experience psychological distress from using this source perceived to be of lower quality. So to fill this knowledge gap, we first sought to estimate the global prevalence of self-reported drinking water harm and anticipated future harm from drinking water. We also sought to explore whether there were variations in anticipated harm by national and individual level characteristics. Data are drawn from the Lloyd's Register Foundation World Risk Poll, which sought to understand perceptions about modern risks to societal and environmental well-being. The poll was implemented by Gallup, and they used a national probability-based sampling strategy such that we can generate national level statistics and also global estimates of these experiences. Individuals were asked about whether they experienced harm that they believed to be attributable to their drinking water in the past 2 years, and also whether they anticipated experiencing serious harm from their drinking water in the future 2 years. We combined these estimates with data from the Joint Monitoring Program that measures access to basic drinking water services, and also a metric, the Corruption Perceptions Index, which measures the level of public sector corruption at the national level within each country. And then some demographic covariates that we looked at included self-reported gender and household location, as well as a few others not shown in this poster. So our first finding was that more than 1 in 10 people globally reported experiencing water they attributed to be due to their drinking water in the prior 2 years, and that this was most concentrated in sub-Saharan Africa. Our second finding, and perhaps most shocking, is that more than half the world's population, representing approximately 4 billion individuals, anticipate future harm from their drinking water, and that the prevalence is high in many countries, both high and low income countries. We then sought to understand whether anticipated harm varied by the access that a country has to basic drinking water services, which is a source that is designed in a way that limits pollution and also is accessible within a 30-minute round trip walk. And what we found is there were no strong trends between drinking water harm, anticipated drinking water harm, and water source within a country, except when you went beyond 95%. Once we reached this threshold of more than 95% of the country having access to these services. But even beyond this, there was huge heterogeneity in experiences of anticipated harm. So for instance, in Greece, about 60% of the population reported anticipating harm, whereas Finland, only 10%, even though in both countries, 100% of the population was estimated to have access to this improved water source. What was most strongly associated with anticipated drinking water harm, though, was the level of corruption at the government public sector level. So higher values on this index represent less corruption and more stability within a government. So this demonstrates that as governance improves, so too does anticipation of serious harm from drinking water. Looking at individual characteristics, while we see differences in anticipated harm by low-income countries and high-income, there isn't a strong association by gender or urban or rural household location. So taken together, this means that billions of individuals are concerned about their drinking water, and that there needs to be more serious investment in both improving water equity, but also its governance and relationship building between water service providers and the communities that they serve. I look forward to taking your questions.
Thank you, Joshua. I'm monitoring the chat tab now, and it looks like we have a question. So if you could share your poster, that would be great. All right, our first question is, how prevalent was the decision by a consumer to switch to bottled water based on taste, disinfectant residual versus lack of trust in the provider or transparency? What percentage of those choosing enhanced water source actually knew anything about the quality of bottled water?
That is a really great question. Thanks for asking that. Unfortunately, those data weren't collected. So this was a pretty simple analysis. There were a lot of different risks asked about in this poll. So the questions were as simple as, do you anticipate serious harm from your drinking water in the next 2 years? And people could have interpreted that however they wanted to, whether they thought there was lead in their water or salt, or they just didn't trust it because they didn't trust the government writ large. And it seems like the perception of government mistrust is actually maybe one of the more salient factors. But it would be interesting to also, in future iterations of this survey, to include questions more directed at perceptions of quality and preferences for different sources.
All right, there aren't any more questions right now. Is there anything you wanted to add about your research?
I would just say that this is exciting to me to be able to work with these data. The Lloyd's Register Foundation put out this new poll, and I encourage everybody to look at it. They individuals all across the world in nationally representative surveys were asked about modern risks, everything from bioterrorism to water quality. And we are just starting now to look at the relationships between perceptions of water harms and health. And I think there's a lot of rich data here. I think it's pretty stark that half the world's population reported that they anticipate harm from drinking water in the next 2 years.
All right, well, feel free to continue putting questions in the chat tab, and we can move on to our final presentation, which is Allison Salinger.
This study was designed to assess the relationship between participatory community engagement activities and social capital. Studies have demonstrated that baseline social capital can be predictive of both participation in and outcomes of WASH interventions. But that begs the question, what do we do when we're working with a community that has low baseline social capital? We hypothesize that participatory community engagement can have a positive impact on social capital among diverse men and women. We're testing this hypothesis in the context of the RISE trial, which is a cluster randomized control trial being implemented in urban informal settlements in Suva, Fiji, and Makassar, Indonesia. In order to measure social capital, we administered the Short Adapted Social Capital Assessment Tool, or the SASCAT, to 1 man and 1 woman in all RISE households. We conducted a confirmatory factor analysis to test the SASCAT factor structure, and then modeled the effect of the intervention on the CFA-informed social capital subscale scores. It's important to note that we modified the SASCAT items to refer to the time period before COVID-19 in order to assess what social capital was usually like in these communities. However, in Fiji, this captures the time period after the initial community engagement activities, but before the intensive participatory co-design workshops. The visualization of our CFA results shows the factor structure set out by the SASCAT, whereby structural social capital is made up of these 5 items, and cognitive social capital is made up of these 6. The grayed out boxes represent SASCAT items that were not sufficiently related to the assigned factor. So you can see that the CFA confirms a 2-factor solution, but the factors themselves are made up of different sets of indicators depending on country. For example, sense of fairness was not related to cognitive social capital in any of the models, whereas trust in strangers was also not related to cognitive social capital, but only for respondents in Fiji. The factor structure for men and women within each country was the same, which suggests that social capital did not function differently by gender. We then created country-specific subscale scores. So for example, the structural social capital score for men and women in Indonesia is the sum of group membership, social support from groups, and social support from individuals, but does not include collective action or talked to leader. All models were adjusted for clustering at the settlement level and for average settlement wealth index. In Indonesia, the intervention was positively related to cognitive social capital in both men and women, as well as positively related to structural social capital in men. In Fiji, the intervention was negatively related to both types of social capital in both men and women. While adjustment for a very small number of clusters inflated p-values, we can see that the trends in the adjusted models are consistent with those shown in the unadjusted models. The findings from Indonesia provide empirical evidence that participatory community engagement can, in fact, bolster social capital. The findings from Fiji are a bit more difficult to interpret given the reference timeframe for the SASCAT items. It is possible, for example, that the early intervention activities created tensions that were not able to be resolved in the time period before the more intensive co-design workshops. You'll notice in our next step section that we are collecting qualitative data in both countries to better understand these results. Finally, social capital functioned differently by country, reinforcing the importance of adapting tools to local context and confirming social capital factor structure. And in Indonesia, the results indicate that men and women differentially experience and benefit from participatory engagement, which indicates the importance of collecting data that can be disaggregated by gender in order to capture intra-household differences. Thank you so much to my colleagues at Emory and Monash universities and our partners in Fiji and Indonesia. Thank you for your time and attention, and I look forward to answering your questions.
Thank you, Allison. If you could please screen share your poster, and I'm monitoring the chat for questions. While we're waiting for questions, I was just curious to see if you could elaborate on the next steps that you mentioned.
Sure, yeah. So we're in the process of holding sort of contextualization workshops with our partner teams in Fiji and Indonesia to help contextualize some of these more abstract ideas around trust and what that looks like in these communities. And then also collecting qualitative data. The qualitative data in Indonesia has already been collected, and we're in the process of sort of quality checking that. And we have plans to collect qualitative data in Fiji as well this year to understand the co-design and participatory engagement activities from the perspectives of the residents themselves.
All right, well, I don't see any questions yet, but is there anything else you'd want to share about your research while you have some time?
Yeah, it looks like there's a question from Jay. Did you see any differences in social capital and community age?
Thanks for catching that.
No problem. And what participatory engagement activity was used? Yeah. So we did in an earlier iteration control for age and didn't see any meaningful differences to our outcomes as a result of that. Our respondents didn't have a very large age range. And in terms of the participatory engagement activities that were used, it was really a series of activities. Each community, both intervention and control communities, appointed a community engagement committee to represent the community. And then that committee worked with the RISE staff to plan these intensive co-design workshops. And those were a multi-day event where people mapped out their community, talked about who owns what land. Households were put in servicing clusters for shared infrastructure pieces and talked out how they would pay for upkeep and maintenance of those pieces, what that would mean for each household, and where they would sort of install those pieces in the community. And I think a lot of contextual information was also brought into the design of the infrastructure at that time.
All right, well, I don't see any more questions right now. Just keep in mind that you can continue to ask questions in the chat tab even after the session is concluded, and presenters, you can go on back and answer those questions in the chat tab. Give it one more minute. But just, I can share our announcements for today, just to remember to head over to Remo for the networking with sponsors and colleagues. That starts at 3:30. Allison, is there anything else you'd want to share? Or
yeah, I'd just say keep an eye out for this eventual publication, and this team is also producing a couple of other pieces. We looked at the co-design and participatory engagement process using the consolidated framework for implementation science or implementation research, using interviews with the residents as well as interviews with RISE staff. So that piece will be coming out hopefully in the next year or so as well. And then we're planning on producing a toolkit that goes into a lot greater detail on what these activities looks like in Indonesia specifically.
All right, great. Well, that concludes our session for today, and thank you for attending.